Welcome to PhD with Women on It, Hack the Future. My name is Beata Young, and today's PhD Positivity Hack delivered will be by our guest, Karese Laguerre. Topic of today's discussion, how to improve your well-being. Episode 73 starts here. Right after the summer break, what could be better than talking about well-being? Let me remind you, this is a grassroots community that focuses on women on IT, inclusive forum of women in technology, startups, and female leaders who are supported by men as well. And I bring my heart to that hustle because empathy is my motto, and empathy is critical when you are going to improve your well-being. First of all, I would like to congratulate our lovely lady, Laura Mercurio. She's been our PhD guest a couple of months back, and now she is going to take a role of CEO of Blockchain Australia. If you are working in the blockchain, you should reach out to her. This community is the leading voice to drive innovation and change for Australian businesses in the blockchain space. Well done, Blockchain Australia. You definitely headhunted a great brain. Congratulations to Shiba Wilson on launching her book, Get Up and Lead Every Day Above Defeat, a must-read book for anyone going through difficult times. Get your copy of Get Up and Lead Every Day Above Defeat on Amazon or directly through Shiba's website. Our PhD guest, Richard Friesen, just hosted a Strategy Supercharger webinar, Profitable Trading Career, last August 24th, continuing teaching others about investments, and I can't wait for more webinars. In today's episode, we are going to learn how to improve your well-being. The world has changed. We live longer and have access to better medicine. We work harder, and yet our bodies are not designed to keep up. We are constantly stressed, tired, and not doing the things that make us happy. How about something that will help improve your sleep, health, and quality of life? Our guest for this positivity hack delivered is Karese Laguerre, a registered dental hygienist and myofunctional therapist who has written the book Accomplished: How to Sleep Better, Eliminate Burnout and Execute Goals. Through tele-therapy, she helps clients of all ages overcome tongue ties, TMJ disorders, sleep apnea, grinding anxiety, and various breathing and orofacial facial dysfunctions. My goodness, I already have some dysfunction with my tongue today. She's changing the quality of life of her clients through the Myo Spot, a practice that amplifies oral wellness to whole body wellness through dynamic myofunctional therapy. We believe that everyone deserves to feel good about themselves, and we strive to help you just do that through this episode. So stay tuned for our talk with Karese as an opening episode after our PhD live stream break. Karese, let's start with a simple question. Where in the world are you today?
I am in South Florida, so I'm near West Palm Beach area. I am in the sunny skies of Florida right now.
So in the sunny Florida, do they have problem with wellness?
Oh, of course, everywhere we have problems with wellness. We are essentially a society that is so moving. We've industrialized ourselves to the point where we're at levels of stress and sleep deprivation globally. So the World Health Organization declared sleep an epidemic and something that we're not getting enough of just globally back in 2005. So we've been experiencing a whole lot of wellness and poor wellness, I should say, as a society for quite some time now.
I hope that epidemic is not going to cause us to have lockdowns, but sometimes it's good to lock yourself down in your bed. Let's start with what is myofunctional therapy? Can you explain that?
Absolutely. So, myofunctional therapy, in the easiest way I can describe it, is kind of like personal training, but for all the muscles below the eyes, yet above the shoulders. So, we'll work with the over 100 muscles that are in this complex area here to help strengthen and coordinate these muscles. Because if you think about where these muscles are, this is essentially the borders of your upper respiratory system. And we know that nothing is more important than breathing and air. We can go for weeks without food, we can go for days without water, but not many of us, if any of us, could go for any more than a few minutes without air. And so, how you use these muscles that support your upper respiratory system is going to greatly impact many different aspects of your life. Your cognitive, mental health, it's going to impact your dental health, it will impact your digestion, it impacts your speech, your breathing. It's all throughout your body that you're going to feel those impacts. And so my main focus is amplifying a lot of what's happening here to ensure that you get better sleep, because sleep is the key to overall body health.
Absolutely. I also found out that research has found that myofunctional therapy may also be an effective treatment for sleep disordered breathing, a group of sleep conditions that causes, among other things, snoring. And that's one thing that I would like to ask you about, how to prevent people from snoring via this therapy.
Yeah. So when we think about our breathing, right, let's just go from the very basics. So if we are to respirate either from our nose or our mouth, what's happening? It's going to go down through that upper respiratory tract, which is kind of like a little circle, right? And so when we're lying down and we're respirating, standing up, you have a nice open system. But when we're lying down, gravity is now working against our bodies and it's pulling things down and back. And not only is it pulling things down and back, our first stages of sleep is to relax all of the muscles. So our muscles start to relax, and we really, at that point, are at more of a risk of having a very narrow space to work in, because gravity has pushed what was already there, that musculature that's surrounding, it's pushed it, made it a little bit closer, closed, and then that air doesn't have that space to move anymore. So now when you're hearing snoring, that audible sound is what you're hearing in air trying to get through the airway, but it's meeting resistance. So it's getting resistance from the muscles in that tract. So what I would do as a myofunctional therapist is we help you to support a lot of that musculature. So let's go back to my comparison of personal training. So if we think about it from just the area most people are concerned about when we talk about personal training, our abs. If we look at how somebody who has really well-defined abdominal muscles, if they were to lie back, you wouldn't get very much of there being that kind of like splaying or where things are very loose. It doesn't become more loose as they lie back, right? They've got nice toned and supple, strong musculature. But if you have somebody that has a beer belly and they lie back, suddenly now we see that a lot of it starts to fall. It's very lax. It's not very tight musculature. And so it becomes kind of lazy and floppy, for lack of a better word. So we can look at our muscles, because our muscles don't change regardless of where they are in the body. So if we look at our muscles in our throat, if we work with those muscles and strengthen them and help to create a better support system, you get less of that sort of floppiness in your upper respiratory tract, and you're able to breathe better, which is going to disable a lot of that snoring and that sound, that resistance.
Excellent. I was planning to let you speak for a little bit longer because we have not snoring, but in the background we have some celebratory fireworks right at the moment in Malta. Now, absolutely. I'm not sure it's so nice for our cats who are hiding now. But definitely, beer belly is something that you should be working on, dear community members, no matter whether it's beer belly or just lazy belly or just pre-bikini body belly. Right. I've seen one thing, I love things from AliExpress. I'm not trying to advertise, they don't pay me, but on the other hand, I've seen some things that are quite hysterical. I mean, you can change your mouth muscles, you can change the shape of your mouth when you do some muscle exercise. Is there truth to that, or is it all just trying to get some money out of us geekos?
So there is some truth to it. When we are working our muscles, we're also working our fascial system. So fascia is a part of the connective tissue, and it kind of wraps around all of our muscles all throughout. And that fascia, when we think of things like hyaluronic acid that they put into those wonderful serums and face creams to try to help you look younger and make wrinkles disappear, it's really to give more elasticity to that connective tissue, because hyaluronic acid works like a lubricant almost for our fascia. So with all the musculature we have going on around our skull, and this is like where everybody's focused when we talk about looking younger and being healthier. Nobody cares if your neck is wrinkled or if that isn't looking ideal. But the face, everybody cares about. So when we talk about really supporting those muscles by doing exercises, by being active and making sure that we are actually working the muscles and keeping them nice and lubricated with that natural hyaluronic acid, that is going to create an improved appearance to that skin and surrounding structures. So you'll find that your collagen is lasting just a little bit longer. You're able to look more youthful. You might even have a little bit of a glow. We do see that some people actually change as far as their complexion, because they will look a little bit more lively, a little bit more youthful, a little bit more joyful. That vascularity, because all of the blood would be flowing really well throughout this musculature. So it's actually incredibly important and vital to our youthful appearance that we work out those muscles and all the supporting structures. So it's not just for money. It is actually a helpful way to keep yourself youthful.
Thank you very much. That's fascinating. I might buy something. In the meantime, let's go into some questions from our lovely audience. Olga Vasina is asking, fascinating, Karese. So we need to pull ups for our throat to preclude snoring.
I like the way she said that. Yes. So pull-ups, you know what muscles those are working, right? You're getting a lot of that arm when you're working out the throat muscles. Yes, it's not exactly a pull-up, but different activities such as gargling or even humming are going to make those muscles activate and engage. And so we're working on, yes, the muscles in our throat to help us to prevent or reduce definitely a good amount of that snoring, because we don't want our air to meet any resistance as it is going through our passages. Remember, how we breathe is critical to life.
Absolutely. How we breathe is definitely important for how we think as well. Another question from Marianne Madera. Hello, Karese. There are times I feel embarrassed for not pronouncing certain words properly, just like me, Karese. Vlad Cloud Gland. Any tips for Marianne?
Absolutely. So when we're looking at speech, a lot of speech involves oral motor skills. So what exactly is your tongue supposed to be doing to get proper articulation of certain words? What should your lips be doing? How should everything be working together? So yes, there's a lot you can do to help out with your speech. I would say that a lot of oral facial exercises are particularly going to help. But when we're talking about those specific words, I would definitely work on the front of the tongue and how the front of the tongue is interacting with the rest of your structures. If you have difficulty getting your tongue up to the roof of your mouth, just lifting it up, and you think that that's a basic task, but there are people who very much struggle with identifying their tip of the tongue and isolating it from their jaw. So I would personally work towards tip of the tongue, making sure that you're able to isolate it from your jaw movements, and you're able to mobilize it in an upward fashion, and that you're also able to spread it. So we want our tongue to be able to relax and contract. And it's incredibly important when you're making certain sounds, in order for you to alternate through the sounds, you're going to have to relax and contract that tongue as well. So yes, there's lots of stuff you can do to help improve your speech and pronunciation of various words that you might struggle with.
Karese, I'm already listening to you and I'm exercising my tongue. I have to say, it's all fascinating. But let's start with some basic things everybody could do easily at home. What would you say is the best practice every day, 5 minutes of what kind of exercise you would recommend for good well-being of our tongues, body, mind?
Good. So the very first thing that I would absolutely recommend is that you start to implement a nasal hygiene routine. It might seem like it's not helpful at all, but it's actually incredibly important. The way diet and exercise go together is the same way that myofunctional therapy and all the exercises for this region and cleanliness or nasal hygiene, cleaning out that nasal passage, making sure your sinuses are clear and that upper respiratory tract is nice and clear and free from a lot of that bacteria that might be building up, inflammatory processes. And so keeping that open, critical. Okay, so start with the nasal hygiene routine, a saline rinse. Some people hate it when I bring it up, but the neti pot is a really great way to cleanse out the nose. You're essentially taking either water or preferably a saline solution, and you're going to, drain it up one nose and it'll come back out the other, and you're really cleansing out really there exceptionally well. Or you could take saline and you can squirt it up the nose and you can make sure that you're cleansing out all of that upper respiratory passage. So cleaning out the nose, number one, daily tip, biggest thing you can do to implement a better upper respiratory tract and better orofacial health. Secondarily, I would try to work on, as much as possible, the tongue suctioning up to the roof of the mouth. A lot of people don't know this, but the tongue actually has a place where it should be at rest. So take a moment, have your feet flat on the ground, sit up nice and tall, take a deep breath in through your nose, and then exhale slowly through your nose. Inhale again through your nose. And as you're inhaling, and I want you to start to exhale now, I want you to just take note of where your tongue is. Where the tongue should be is lightly suctioned up against the roof of the mouth. So from the tip of the tongue, right behind the two front teeth, all the way back across the entire roof of the mouth, all the way back towards the throat by the soft palate. If you feel your tongue maybe half up, if you feel it's kind of floating around in the middle of your mouth, if you feel it very low, all of these are indications that something you should definitely work on is that tongue to palate, which is the roof of the mouth contact. So you want to try to establish getting that suction and seal. So the suction you would achieve by simply, if you're going to make a clicking sound with your tongue, and I know that might be difficult for some, but make a clicking sound. What's happening there is you're achieving that suction and releasing it rapidly in order to make that clicking. And so we're going to have that tongue stick up there. So try to freeze it at the top and work on getting it to be a full suction and seal throughout the entire roof of the mouth. So you want to ensure that the back of your tongue is getting up too. So it sounds simple, but being able to hold and sustain that hold for upwards of 2 minutes, but that's a great quote. It seems like it is simple, but being able to hold that for upwards of 2 minutes is going to be incredibly helpful in your journey towards improving your orofacial health and respiratory health.
Right, I'm already practicing alongside you. One thing I wanted to ask you, because the proximity of lovely seawater is making me wonder whether, instead of doing that routine of going through with salty water, I was thinking maybe a little swimming, diving in the water would be better way of doing that exercise.
Potentially, but how much of it are you going to respirate? Like you wouldn't want to intake too much of that seawater in your nose for too long. With the neti pot or with the saline, it's a really controlled amount, and it is safe for some level of ingestion because not all of it winds up coming back down. Some of it comes, down the other way and it winds up in your belly. And so it could
Okay,
help.
Dr. Karese. All right, all right. I'll do that. Now, I definitely have this problem, and I even bought myself a little silicone brace to stop from clenching my teeth when I sleep. Is there a way to improve my health and stop clenching my teeth?
So, clenching is a compensatory pattern that we're finding as myofunctional therapists. We are able to relieve. It's an overactivity of your muscles, those masseter muscles, in an effort to help your body open up your airway. Or at least that's the theory for now, right? Or the current hypothesis that's being tested amongst various research projects that are currently ongoing. And so, what the mouth brace does, or a mouth guard, or anything that's kind of sitting in between those teeth, what's doing is really protecting your teeth. It's not necessarily stopping you from creating the action. It's actually, in a way, giving you more impetus to do a little bit more of that action. And so, what we're finding is with myofunctional therapy, we're able to help those muscles that are overactive relax, because we start to engage different muscles. And so, we're able to kind of counterbalance and create a harmony amongst these soft tissues. And we find that we get a lot of people who no longer need the mouth guard or the mouth brace or a splint to help them to stop from breaking down their teeth. It's eliminating what's causing the action, that overactivity of the musculature, as well as your body just trying to open up that airway. So getting in and being able to really support that airway just naturally significantly will reduce the response.
Right. Now we have question from In Love and in Pain, and I believe it's a more kind of a not more soul than body question. How, Beata and Caris, how to balance loving ourselves and loving others? That's a
I
tricky
think
one.
that's super important. I love that question. We have to have that balance. So, what I find is that in what I do, a lot of this stuff does not just happen when you're 20 or 30. A lot of this stuff happens very early on. What's your birth history? How were you fed as a baby? Did you have a pacifier, any thumb sucking? Did you have a sippy cup? A lot of this stuff over time kind of builds up to orofacial dysfunction. And then it doesn't get remediated, or it doesn't get corrected until the child is now a full grown adult. And so we wind up with a lot of, guilt. Why didn't we know better? Or we now have children. How come we didn't do better? How come this is happening the way it is? So what I like to say, and going forward, when we're trying to forgive ourselves for things that we have, potentially caused, or things that we can't correct, it's really important to always be looking forward. And I think that that's a really great way to start that balance, or that shift between, forgiving yourself for what you can't fix and being forward and attentive to what you can fix. I have this wonderful affirmation that I keep on my wall. It's actually right up there, and it says, I should be seeking, not searching. So you should be seeking solutions. You should be seeking more love, seeking more support, and not searching for all of the whys or the hows or, what ifs. Seek to always, get the best next step, and don't look back. Don't look back at all.
Namaste. Well done. Thank you, Caris. I wasn't sure what you're going to say, but there you go. You've got answer to everything. Seeking more love, not searching. And I would add to that, one life, no regrets. Remember, there is also one I came across this quotation yesterday. I'm not exactly sure how it started, but definitely it was talking about women feel guilt so often, too often. We should stop feeling guilty. Right, let's go to next comment. Olga Vasina is saying, thank you, woman on it. It's a joy to see you back and another fascinating guest. Great to listen to Caris. I love our guest as well. And Olga, thank you so much, Caris. We'll definitely do that exercise. We just mentioned exercises. So Marianne is ready to hack the future. And after learning some amazing therapy tips and hints, she starts doing them and implementing. Karese, tell me, how did you start that therapy? What inspired you? Who inspired you?
My children. So as a parent, we always kind of wind up falling into things because of our children, and my story is no different. I am a licensed registered dental hygienist, and it was working for a pediatric dentist that things started to come together for me that in things that I was experiencing with my children. Now, I always say that with parents, we always give the highlight reel. If somebody says, "Hi, how are you? How's everything going?" We're going to tell them all the good stuff. This one's in soccer. This one's doing great. This one's made the honor roll. Everything's wonderful. We give all the highlights, but we never talk about the things that are honestly incredibly common, but that are struggles in our household. There's always some sense of shame in that. And so what I found is that when I was working for this pediatric dentist and she was kind of opening my eyes to all the things that was going on, I have 4 kids, and my son is the oldest and he's the only boy, and he had ADHD and a lot of behavioral and impulse control issues. We were in the principal's office quite often. School was not a pleasant time for him nor us. My oldest daughter had every sleep issue under the sun. She had, night terrors, bedwetting, sleepwalking, sleep talking, tossing and turning, you name it. We went through it, and it was consistent every single night for over 10 years. Then my younger 2, they had a lot of upper respiratory issues. So chronic ear and throat infections. There was always antibiotics in our house. They're constantly congested. I mean, it was a nightmare in my home every day. But if anybody was to ask me, they would just get the highlight reel of all the good things that were going on. But that pediatric dentist I was working for, very into how orofacial function and breathing plays into all of those things. And it was really in working with her and in uncovering the reality of my children, because my son was not his ADHD. My daughter was not her sleep. My other children were not a result of all of their infections. They were kind of hidden behind all of this stuff that's kind of suppressing their ability to really flourish and thrive. And so in doing the myofunctional therapy and diving down that hole and being able to help and see the changes in my family, I couldn't help but spread it and help everybody else realize how much more powerful life could be when you're able to function on full.
So did you have some background before starting your career as a therapist, or was it just because you were passionate about the topic you started delving into it?
Yeah, I have a little bit of background. I think it's a very difficult field to almost understand entirely until you wind up in it. So I had a little bit of background working in dental and being in that environment where I already had someone who was very knowledgeable about this, and we would go to continuing education courses together. But it took me a little bit to put all the pieces together for my children. But once I realized I could help my children, that's when I really dove deep. I took and invested in multiple continuing education courses to really get in there and make sure that I was able to support them the best that I could. But yeah, I have a small background, but we still find that currently to date, it's still only 1% of dentistry that is sufficiently knowledgeable enough to treat and or manage a lot of these upper respiratory or airway issues.
And as with any knowledge, you have to expand it and keep learning. Everlasting learning is definitely a key to the future. So, Karese, how did it help, for example, your son with ADHD?
Yes, I love that question because I think not enough of us are aware. And so I'm so happy you asked. So ADHD is, we have to remember, a symptom-based diagnosis. There's no blood test you can get. You can't do an MRI or a CAT scan. There's no definitive way to test for it. It's based on what the symptoms are. And when we look at the research or we look at the differentials, because it's incredibly important to have a differential diagnosis, there's over a 70% overlap between the symptoms and manifestations that are present for ADHD and the symptoms and manifestations that are present in sleep disorders for children. So when you take that overlap and you're looking at that and you say, well, this one I can test for because I can get a sleep study, I can definitively get imaging and things that are going to quantitatively tell me whether or not there's a sleep issue, as opposed to this one that's just going to look at the symptoms and say, okay, these symptoms sound like ADHD, here's some medication. It's incredibly important to go for that differential. And that's why actually what it wound up being for my son is that he had a sleep disorder. He had sleep disordered breathing. And that in and of itself was impacting his day-to-day. That was impacting his hyperactivity, his inability to focus, his cognitive and mental abilities, I should say. He was not able to function really well because he wasn't sleeping really well. That also impacted his growth and development. I mean, we had a lot of issues. And I wish I knew sooner, because we would have intervened so much sooner had I known that it was really about his sleep, about his breathing, and his orofacial wellness and health. If we had known that, I definitely would have gone down that road. But ADHD, I think, is something that we have to start talking about, and at least to talk about what the differential could be. Because when there's an overlap and there's no way to definitively test for ADHD and it's just a guess off of the symptoms, we need to start looking at other alternatives so that other children, other families aren't struggling with this and they can get to their next best. And just to kind of wrap up really quickly with my son, he is now 18. When he was about in grade 5, 5th grade, he was maybe 11 or 12. We started coming across all of this, and he was almost going to fail out of primary school. Like, he was not doing very well. But we fast forward to today. He's 18 years old. He graduated high school a year before his peers. He's in college now. He is thriving. And who would have guessed? Who would have guessed that this child who was struggling to get through primary school, who could not focus, could not pay attention, had all these behavioral issues, no one would have guessed that all we had to do was help his sleeping in order to get this brilliant child who was able to surpass his peers in his later school years and able to complete high school and start college a year early. We never would have guessed that. And so that's my driving passion, my son and his amazing story.
Well, I guess this amazing woman of a mother had nothing to do with his success, right? Karese, come on, let's face it, right? He had an amazing role model in front of him. So, but let's ask you about, because ADHD is quite common nowadays. We've got so many triggers, so much happening around us with social media and so on. I was wondering, is there a different approach to a kid with ADHD or a girl who just have problems sleeping?
Is there a different approach? So when we're looking at ADHD, the most common approach is to really look at the symptoms and to, at that point, figure out what it is that we can do to help manage and mitigate them. So in a lot of cases, medication winds up being that route. In some cases, people manage it by dealing with the diet, making sure that they're not giving them too many stimulants, or making sure that they are adequately stimulating them in the morning. So people use vibration plates. They're able to kind of like challenge and stimulate their brain using different sort of textures and getting them to kind of down regulate a lot of that hyperactivity. So that's one way to manage it and to look at ADHD. You can look at medication, or you can look at alternative ways to really deal with the symptoms of such. When it is sleep, or it's a sleep breathing disorder, well, then that's a whole different route. So at that point, once you've done a sleep study, which is going to give you your diagnosis, from there, it's not a medication managed thing. And in some instances, it's not even like a dietary managed thing, although there are dietary parameters around sleep that I think we're all very familiar with. You don't want to eat too close to bed. You definitely don't want to have sugar as like the last thing before bed, at least not within 3 hours before bed, and stimulants such as caffeine and so forth. I think we all know the parameters about sleep. However, With children, it's really ensuring that, one, you're getting that nasal hygiene. You want to have their noses open and facilitate as much room as possible for them. Having maybe a nasal strip on the outside of their nose, or a nasal dilator. That way they're getting more oxygen through their nose. There are some people who would mouth tape to ensure that the oxygen that they're inhaling is coming all from their nose, because our nose is made for breathing, and it is the optimal way for us to physiologically get the adequate amount of oxygen that we're supposed to have in order for our brain to work properly. And so once we're getting all of that kind of open, and we're dealing with the children in a more natural, supportive way, and ensuring that they're able to breathe optimally, then we're finding that they're not experiencing most of those symptoms that they've had previously. So there's two different routes you can go, but I definitely 100% prefer the sleep and the natural management route over medication.
Well, I guess you touched upon why it is important to have a very good sleep. How does poor sleep impact health and productivity? Can you explain that?
Yes, I love that. Okay, so when we are sleeping, our sleep as we know it right now, and science doesn't have all the answers about sleep as of yet. Okay, so what we do know about sleep, we do know that it is a restorative process. That is the only time in which our brain is going to implant all of our memories of the day, intake all that information, and kind of like store it away in our little receptacles of centers where we keep all that information and our wonderful memories, so that it goes from short-term to long-term memory and so forth. It's the only time the brain is really going to cleanse itself. So we have our lymphatic system that we know about, our endocrine system. Like, we're able to flush the body of things, yes, but our brain, it actually doesn't flush actively during our wake cycles. It only will flush itself of any sort of toxins and clean out through the blood-brain barrier only when we're sleeping. And so when we think about that, it's important, first of all, for our cognitive and mental health, that we sleep. If we're not sleeping, we're going to see poorer performance the next day. So we can link very, very clearly Alzheimer's, dementia, and memory. I was going to say memory wellness. Well, let's say that. And memory wellness, we can link that to sleep, and the quality of such, or your risk factors of such, are going to be impacted by having poor sleep. Performance and productivity, when you are sleep deprived, is almost exactly your brain function if you are intoxicated. So if you've had too much alcohol and you are in a drunken state of mind, you lose your balance, you lose your ability to critically think, you can't speak as clearly, your thoughts aren't as fluid, you're enabled. And so when you are sleep deprived, it's actually very, very similar. You're experiencing a similar quality of your current cognitive awareness and attention. You cannot thrive while you are, or you can't make good decisions at all of any kind when you are not getting enough sleep. So sleep is going to impact your cognitive health. But we also need to remember that our sleep is also going to impact the rest of our body. So when we're sleeping, if we're not oxygenating well, that's going to impact the brain. The brain is the power center for the rest of our body. Our body is always going to try to keep us alive. So if we're not breathing optimally, our body is now goal focused on making sure that we stay alive. It's like, we're not getting a lot of oxygen here. We've got to take down some of these resources. So we're not going to get cell regeneration. We're not going to get a really great overturn of a lot of these cells that are going to help stimulate new and restorative processes in a lot of our organs. We're going to see that we will be detrimented in our immune system, in our cardiovascular system. We won't get really good optimal blood flow. Like, we're going to see a slowage in our digestive system. So that's going to affect your metabolism. So there's a multitude of ways that having poor sleep will affect your body. But the primary one, especially when we're talking about productivity, is the cognitive impacts that it'll have.
Right, and now I have a question, and it is based on your talks and on our discussion. I am wondering, because you mentioned CPAP. What is CPAP and how does myofunctional therapy get people off their CPAP?
Yes. So a CPAP is a continuous positive airway pressure device. And that is going to be in either a mask or a nasal cone or cannula that is going to be on your face or on your nose. And it's going to push air essentially through your upper respiratory tract. Now, pushing that air through your upper respiratory tract helps to keep open your upper airway, because it can't collapse if there's just air blowing down it. It's like walking against a wind tunnel. So if you see a wind tunnel and you're trying to walk down and you can't, it's pushing against you, a lot of that wind. So it's pushing air to keep all of your airway open. Keeping that airway open is essentially one of the goals of myofunctional therapy. What we're trying to do, remember that analogy I made between the abs versus the beer belly, where the abs nice and tight, you're not going to get too much movement, even though gravity's working against you when you're lying down, versus the beer belly, where you're going to get a lot of flopping or movement, or you're going to see the belly fall to the side. Like, you're not going to have that nice tenacity to help you keep everything together. So with myofunctional therapy, what we're able to do is really open up that airway using more natural methods, by having a lot more strength and awareness of those muscles of our oropharyngeal path, and even just making sure that we are aware of how we're breathing and that we're not breathing through our mouth, that we're breathing through our nose. We get our tongue up, because remember, that tongue has a place where it should sit. So that tongue being up and out of the airway is critical and key. So having that tongue up against the roof of the mouth keeps it out of the passageway, so it doesn't fall back in there and impact that that upper respiratory tract anymore. So we keep it nice and open. And so that's where they work beautifully hand in hand, where you may start out with a CPAP and you might not need the CPAP near the end of your myofunctional therapy program, because you've come now to this point where you don't need air to manually keep open your respiratory tract. You are now keeping it open by just having it nice and toned and being very aware of those musculatures.
Beautiful. Thank you so much, Karese. We've got a question from Olga again. Olga is asking, can you improve your facial muscles to help alleviate lung problems?
Interesting. Yes. So the facial muscles, as we will remember, is the borders. So this is all the borders of our upper respiratory tract, right? And the upper respiratory tract directly connects down to our lungs. So when we're breathing, and especially one of the goals of myofunctional therapy is to make sure that we're facilitating predominant nasal breathing. When you're breathing and you're breathing through your nose, you're able to get air all the way down into the lower lower one third of your lungs. Okay. So when you're breathing through your mouth, or you're breathing inadequately, or you're shallow breathing, you're typically breathing more so with your chest, and you're not actually using your diaphragm to support your lungs, which in turn is going to affect your lung health overall. So we're going to see that when we are shifting from that shallow chest breathing that's only going to fill maybe 2/3 of the lungs, and it's the upper 2/3, you're not getting deep down in there, to the last 1/3 where you're getting your quality full breath of air, you're going to see that, yes, if you are working on all of the muscles in your upper respiratory tract, and you're making sure that you're facilitating an open airway and an airway that can support nasal breathing, you're going to get better health overall of your diaphragm and your lungs.
Thank you so much, Olga, for your question, and Karese for your answer. What about runny nose? Once every so often we get a runny nose, and then what? Is there anything we can do for our breathing?
Absolutely. So the runny nose is pretty much your sinuses emptying out, right? So you've had so much stuff that's building up over there, so much mucus and so much stuff that has to come out now, that it's just really like leaving your body like a flood almost with the runny nose, right? That's what we can think of it as. It's almost like a flood. And so what we're finding is that once we are really taking adequate good care of our nasal passages, of our sinuses through nasal hygiene, making sure that you're cleansing out that passage, making sure that you are facilitating proper, adequate nasal breathing, because with nasal breathing, you're going to inhibit a lot of those functions that would allow those sinus cavities to really build up to excess to where you're getting that runny nose, right? So what we want to do is we want to make sure that we're facilitating a good nasal hygiene routine to keep everything nice and open and clean. And we're constantly, it needs to be a daily habit, because otherwise you're letting too much stuff build up in the sinuses, and then creates a lot of pressure in here. And it creates a problem where some people wind up with headaches because of so much sinus inflammation. And so they're getting these headaches here. And we don't want that. Cleaning out the nose is going to be the best way, the optimal way to help you prevent having those runny noses and having sinus inflammation and sinus congestion.
Absolutely. I wish you a less runny nose, more myotherapy. I wanted to ask you about your book. Who inspired you to write the book, and is it available on any platform?
Yeah, so what inspired me is really the fact that I realized I am a human, right? Like, I can only be in one place at one time. I can only help so many people with my time, because that's a finite amount of time, right? So I wanted to make sure I spread the word to as many people as possible about the impacts and the wonderful benefits of breathing and how that can impact your sleep. Because when people think about sleep, they only think about like the surface level tips, right? So you think about, oh, you don't want to have caffeine, you don't want to use your phone, maybe you want to have a certain pillow or a certain mattress. But some of these things, it doesn't matter what you do. If you're not breathing properly, you're not going to get great sleep, regardless of how many tools, tips, and tricks the internet has given you. So I wanted to spread the word in a way that would be easy to digest. So I love the book. It's called Accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals, because it really gets to the point. It dives in deep on what exactly it is that might be preventing you. What are the blocks, the physiological blocks, and the personal blocks that are blocking you from getting your adequate amount of sleep, from getting what sleep you need, because sleep is specific. Sleep is not, you just need to be in bed for 7 to 9 hours, and then at that point you'll be wonderful. Like, your sleep, you could be in bed for 7 to 8 hours and think that you're getting good quality sleep, but you might not be getting good quality sleep at all. Okay. So it's very important to know all the factors. I really break that down in the book. It's very easy to digest. I talk about my care plan in there. So it's CARE. It's the 4 steps that you can take to ensure that you're getting optimal sleep and that you're starting out your next day with your peak productivity. So it's really a passion project of mine. It's available on Amazon. It is a phenomenal way for you to just learn more about how you can dive into your best night of sleep ever.
Fantastic. It's available on Amazon. Don't go to Amazon yet. Stay with us, because we are going to talk about tongue tie. And I have to admit, I was born with tongue tie, and it had to be cut when I was little. And tell us, what are the implications of not treating a tongue tie?
Yes. So tongue tie, what's interesting is that the best we can do as far as the origins of such is compare it to the fingers. So when we are in utero, at a certain point, we all have webbed hands, right? But then at some point, a lot of that disappears, that connective tissue disappears, and now we have independent fingers. Now, some people are born with the webbing still there, or where the fingers just are not where they should be. And that's its own separate issue. But if we think about that in terms of the tongue, we all have a frenum. Now, a frenum is that short piece of connective tissue that is from the base of your tongue, so the bottom of your tongue, to the floor of the mouth. And you want that to be elastic. We talked about the fascia a little bit earlier. We want that elasticity of that connective tissue. And we want that tissue to not be too far forward, because we need to have a tongue tip. If we don't have a tongue tip, because that frenum is attached there, it's going to impact your feeding. So you won't be able to breastfeed. A lot of these babies can't even do some of the supplementary feeding that you would get out of a bottle. So you'll find that some of those babies are either spoon fed or they're getting their nutrition in some other type of method because they just can't adequately use their tongue to compress against the breast or the bottle nipple in the way that they should. So when we have that, that creates an issue for, yes, the initial phases of life and feeding, critical. So we might have failure to thrive for some of these babies, reflux, the inability to really get adequate gulps of air. I'm sorry, they're getting too much air as they are bottle feeding and suctioning in. And so it would create a lot of issues for them digestive wise and just inability to flourish. So when we're talking about it for a baby, that's one thing. But as you get older, it impacts various other aspects of your life where you're not able to get your tongue up to the roof of your mouth. And the roof of your mouth, remember, that's where our tongue is supposed to rest. That's where it rests. So once we have that tongue up there, yes, you're stimulating your nasal breathing. You're also stimulating your vagus nerve, which is going to impact your rest or digest. So that autonomic nervous system, that way you're able to facilitate adequate really balance of your ability to engage socially. It's going to impact speech on some levels. It's definitely, certainly going to impact your sleep because that tongue won't be able to get up and out of the airway. It's more likely to fall back into the airway as you're sleeping. And so you'll see sleep breathing disorders. And so a tongue tie, it's very important that we manage it early. I like that it was managed early for you. And that means that you as a baby, were able to actually overcome some of those hurdles. But for some people, it's not being recognized until later on in life. And so we have to work on functional correction of all that it has caused at that point.
We have to work also on stimulating our brains now. Let's go into the favorite questions we have at the end of our show. Karese, what is the number book you think, I wish I read it before I started my career?
Oh my gosh, Making Money is Killing Your Business by Chuck Blakeman. That is such a phenomenal book because it really just brings it to the forefront that when you're creating a business, you're not supposed to be working in it all the time. You should be working on scaling it so that at some point your business is working for you. I wish I knew that early on.
Well, it's never too late. Are you working on any exciting projects right now, Karese?
Exciting projects. Well, I'm trying to bring this to more and more dental offices, more and more alternative health providers. So I'm always building a network. I think my newest project right now that I'm working on is consulting and getting into dental offices and really helping them to assess and treat many of these issues so that we don't have people who are unaware of what myofunctional therapy is or the benefits of such. We're able to help as many people as possible.
Absolutely. Now, can you give us your favorite life lesson quote and how did it impact you?
I really love this quote by Johann von Goethe. It is, knowing is not enough, you must apply. Willing is not enough, you must do. In everything that we learn, I think just knowing it is certainly never enough. Once you know something, you have to apply that information or that knowledge in whatever way you can, whether it's about business, whether it's about health, whether it's about finances, whether it's about just parenting or whatever it is. You have to do more than just know the information. You should apply it. And then being willing to apply that information is not enough. Okay. You can't just be trying your best. You need to do, like, as much as you can, make sure that you are doing the thing.
Absolutely. Every day, micro actions. And we have a lot of micro actions today, apart from the nasal hygiene, apart from exercising your tongue and lots of breathing to do. I also would like to point out seeking more love, not searching, is definitely way to go. Karese, thank you so much. Now, let's go into the question I think may not be so relevant because pandemic is nearly over, but let's imagine you can invite any guest in the world to have private breakfast anywhere in the world. Who would you invite and where would you go to, Karese?
So one of my mentors, who I've been blessed to have as a mentor, and I can't wait to see her next week at a conference she's speaking at, but Lois Laney, she created the restorative breathing method, and it is a phenomenal way to deal with a lot of the issues that do come on as an addition to having orofacial dysfunction. So dealing with the cranial nerves and being able to integrate and getting dynamic body movement and so forth. So I would sit down and eat with her any day of the week, pandemic or no pandemic. I'd risk monkeypox to sit in her clinic and to just be able to ask her as many questions as possible and just, soak in and seep all that knowledge into my brain.
Oh, absolutely. Or sleep, since you are talking about sleeping together. And since we are talking about sleeping, laugh, and the word laughs with you. Snore and you sleep alone, Anthony Burgess said. I have another quotation which is very good. And no wonder Sleeping Beauty looked so good. She took long naps, never got old, and didn't have to do anything but snore to get her Prince Charming, Olive Green said. I think this is a perfect summary of today's great positivity hack delivered by Karese Laguerre. I would like to thank our lovely audience for asking us great question. Olga Vasina, In Love and in Pain, Marianne Madera, it was so good to see you today. We have another week of excitement. Next week, we are talking about why metaverse will define the next decade with Or Manor. We are speaking next week. In the meantime, Karese, thank you so much for this positivity hacks delivered. Seeking more love, not searching, is definitely this theme of today's discussion. That's it from episode 73 PhD livestream. Thank you very much, everybody. To stay updated and ensure you never miss a positivity hack delivered, follow Woman on It and turn on notifications to be alerted once a video has been released. As always, our positivity quote comes from Positive Thinking Only and goes, look for something positive in each day, even if some days you have to look a little harder. Today is your day to hack the future, hack the positivity you want. Thank you.
Thank you.